Hi all. Today we have Dr. Ganesh, specialized in orthopedics. Our patients have few questions related to arthritis. Doctor, day by day arthritis conditions are increasing. What are the symptoms and how can it be managed?
Yes, so arthritis is increasing. So it's mainly because there's a lot of people in the elderly age group nowadays. So arthritis is a disease of old age. So now when a lot of people are there in that age, then obviously the number of patients with arthritis also increases. Arthritis is nothing but wear and tear of the joint. So the most common joint involved is the knee joint. So the symptoms of arthritis are very simple. You will have pain. An arthritic joint will be painful. So it goes through many stages. In the early stages, the pain will be less in frequency. You may have pain only when you walk, maybe say for an hour or so. You may have pain only when you climb stairs or when you do any kind of little strenuous activity. But as the stage progresses, the frequency of pain also comes down. So you will have pain even if you walk for maybe 10 minutes. Even your household chores will be painful. So that's how we understand that okay, the joint is going to arthritis. Okay, so now once we understand that we have arthritis, the management also is stepwise. So in the early stages, it can be well managed with some tablets. So we start off with anti-inflammatory tablets. You can apply some gel. A kneecap will help, and of course, lifestyle modification. When you try to restrict the amount of activity you do, it will help. You will get good pain relief. But we can't live like that all the time. So once we again go back to our regular life, we start to get the pain. So in the next stage, when we reach stage 2 or 3, we do have some options. We can probably try some injections in the joint. So there are two types of injections. We have steroid injections and we have the lubricant injection. So there are different indications when you have to give each one. So but that can also give you a bit of relief if you are in that stage, in the middle stages. So injections may give you symptomatic relief for up to a year or so. So sometimes if we take another injection after that, then you are again able to go for another year without much pain. But when it comes to the last stage, which is stage 4, then none of this works. Then you will have to go for something little more aggressive.
So what is TKR, that is total knee replacement, and what are the benefits of doing that?
Yes. So that's the answer to the last stage of arthritis, total knee replacement. So at this stage, like I said, none of the other treatment works, but a replacement surgery works very well. Don't get carried away with the name. Total knee replacement sounds scary, where you may think we just cut off the entire knee and put a new knee, but that's not what we do. We just shave off the worn out cartilage. So I have a model with me. Probably I can, you can understand better with that. So this is how a worn out knee looks like. So you have these lot of areas of degraded or degenerate cartilage. So once that articulates with each other on either side, you get a lot of pain. So this is how the surgery looks like. So what we do during surgery is, so we shave the bone in this fashion. So once we shave it, so here you can see we just shave the articular cartilage. We don't cut the entire knee. So once we shave it, it is in a good position to accept the new knee joint. So this is how a new knee joint will look like. There will be a metal on top, there will be a metal at the bottom, and there will be a plastic in between. So now there is no contact between the two bones. There is only contact between metal here and plastic here. So now this gives a pain-free joint. So this is what total knee replacement is all about. And nowadays it's the technology is very advanced, and we do it regularly, and recovery is fast, and it is a very good surgery which will give a complete relief to all the symptoms of arthritis.
Okay. So doctor, which type of patients are prone to total knee replacement?
Okay, so there are very specific indications. There are three main indications for which this surgery is recommended. So the first class of patients are those who are not able to do their regular activity. They are not able to work even inside their home. Like they are not able to work in the kitchen. They are not able to clean the house. So even those small activities are affected a lot. So that is the first class of patients who will benefit from replacement surgery. The next class would be patients who are not able to sleep at night because of the pain. Sometimes the pain becomes so severe that it totally deranges your sleep. you may go 2-3 months without sleep. So then that is something which is very harmful for the entire, the mental system. So that also is an indication for the replacement surgery. And lastly, there are certain patients who may be comfortably sleeping, who may be able to do all their household chores easily, but if they want to go out, they want to be a little active, they want to probably travel and stuff, and the arthritis may be preventing them from doing that. So that is the last class of patients who will benefit from the replacement surgery.
So doctor, most patients have a question that whether they can do TKR, that is total knee replacement, on both legs at the same time.
Yes, very good question. So there are very specific rules and regulations that we follow. We decide whether some patients are able to get both knees replaced at the same time. So generally, if you ask me, up to 70 years of age, it is safe to do both the knees at the same time because it is very beneficial for the patients. You have to undergo only one anesthesia, only one hospital stay. Your recovery is faster. If you do one knee at a time, then by the time you recover from the first knee, it takes about 2 months. Then you do the second surgery and then another 2 months, so it becomes 4-6 months sometimes. But if you do both knees together, then the recovery is only 2 months. So the patient gets immensely benefited. And so up to 70 years of age, you can pretty well do it safely. I mean, of course, we do all the other checkups, the cardiology checkup, the physician checkup, all that, but it is relatively safe to do it before 70 years of age. From 70 to 75 years, we are a little more careful. We only make sure that, we only do it in patients who don't have much comorbidities like diabetes, hypertension, thyroid issues. So if these patients at this age, if they have these issues, then we are a little more concerned. We want to be sure that everything is well controlled. Some patients we still may be able to do both knees at the same time, but so there will be some patients who we are not able to do. But above 75 years of age, we will definitely not do. We will do only one knee at a time. So this is for, just to be on the safer side for the patient's benefit. But if the patient is okay, then within the next 2 to 3 months, we will do the second side also.
Role of physiotherapy in total knee replacement, what is it?
Yes, so that is another advantage of knee replacement surgery. So the physiotherapy is there, but it is there only for about 1 to 2 months. And that too, it is very simple exercises which the physiotherapist will teach the patient, and they will be able to do it by themselves in most of the instances. So because we are replacing the knee and there are new implants there, the recovery is faster. So the physiotherapy is only to rehabilitate the muscles which were weak for a long period of time. The patients will generally be suffering from pain for about 4-5 years sometimes. So for that long duration, when the muscles are not functioning at the optimal best, then we will have to use physiotherapy techniques to get the muscle strength back. So it is done for about 1 to 2 months, but it is very simple, and patients are generally able to do it without much difficulty.
So doctor, complete rehabilitation time after surgery.
Okay, so patients are able to walk immediately after the surgery. If we do even both the knees at the same time today, then tomorrow they are walking pretty much by themselves. They will need a walker support. So they usually need a walker support for 10 to 14 days. By that time, they are able to get their balance back and they are able to walk freely. So they will be able to patients will be able to do their household work by, let's say, about 4 weeks, going to the kitchen and doing some basic stuff, cleaning the house. But at 6 to 8 weeks, they're pretty much back to normal. They want to travel, you can travel out, you can use your car, bike, whichever. You can go to office. So you're pretty much back to normal life by 6 to 8 weeks. So it is a very fast recovery, yes.
Thank you, doctor. Thank you for your valuable time.
Thank you. Thank you.